and welcome to Where You Go First Matters, our own podcast by Ruby Hall Clinic, Pune's healthcare trailblazer. Today we are going to talk about the most intensive, या शब्दानेच तुम्हाला कळलं असणारे टॉपिक काय असेल, at the same time very intimidating part of a hospital, which is the ICU. As soon as you enter, the sound, the ambience literally puts you on your toes. We are going to talk about the infections, the sepsis that happens in an ICU. And to talk to us, we have the founder and director of ICU Critical Care Unit, Ruby Hall, Dr. Prachee Sathe.
Hello.
Welcome, doctor.
Thank you, Sonalee.
मी आता बोलतानाच सांगितलं की ICU मध्ये प्रवेश करतानाच आपण सगळे थोडेसे अलर्ट असतो. देर इज अ लिटल बिट ऑफ अ स्केअर, भीती, नर्वसनेस, अँड द होल एम्बियन्स इज व्हेरी इंटिमिडेटिंग. But for you, it's a regular, everyday practice. When we talk about ICU, there are so many topics, but today we are going to talk about sepsis.
Right.
So let's jump straight into the topic itself. काय आहे sepsis?
I think it's a very, very important topic that you have chosen for discussion today. But even before we start, I would like to make a comment. You said ICU is scary.
Okay.
Actually, ICU is here to save lives.
Right.
So we are not scared about ICU, or nobody should be scared about ICU.
Mm-hmm.
What they are scared about is something that is happening, going to happen, may happen unexpectedly.
Correct.
Or ultimately every human being is afraid of death.
Right.
And that is what keeps us, fearful when
Right.
we talk about ICU. But I want to know you and all of our audience that ICU is here to help.
Absolutely.
Now you have chosen the topic of sepsis, right? Now sepsis is something, which if it is picked up early, and if the ICU helps early, patient can walk home and without any problems and can lead normal life further.
Correct.
So we want to understand की हे सेप्सिस आहे तरी काय? आपल्याला सगळ्यांना सर्दी खोकला, काहीतरी पायाला लागतं, जखम होते. All that is infection, what we suffer from. कधी कधी होतं भाजतं, पण तिथल्या तिथे ते सगळं क्लिअर होऊन जातं. बॉडी अँड बॉडीज इम्युनिटी टेक्स केअर ऑफ दॅट. बट समटाइम्स इट बिकम्स ओव्हरवेल्मिंग. अँड some dengue patients walk home, but some dengue patients land up in ICU.
Right.
And why does that happen? So when the infection occurs, body starts fighting with it. The patient's body starts fighting with it. And if it is equal and opposite reaction, then everything subsides and the patient reaches normality.
Okay.
But infection is overwhelming and the patient's immunity is very poor. For example, somebody who is elderly, who has diabetes, who has got poor immunity,
low immunity, yes.
They cannot fight that infection, and that infection can cause sepsis. But more important than that, if the infection happens and the body's reaction is much more or exaggerated, that itself also can damage your own body.
Okay, so
And that
anything
is-
more or anything less can be
Exactly.
septic.
It can be a septic process.
Okay.
So what does that mean? जेव्हा आपण इम्युनिटी रिॲक्ट करते असं म्हणतो, किंवा आपली प्रतिकार क्षमता आपली ऍक्टिव्हेट होते आणि आपण तोंड द्यायला लागतो इन्फेक्शनला, तेव्हा शरीरामध्ये बरेच केमिकल्स फॉर्म होतात.
Correct.
विच विल एंगल्फ दोज इन्व्हेडिंग ऑर्गॅनिझम्स. पण ते जर खूप जास्त प्रमाणामध्ये शरीरामध्ये फॉर्म झाले तर दे आर गोइंग टू ऑल युअर ऑर्गन्स, रेस्ट ऑफ युअर बॉडी, अँड डॅमेजिंग युअर ओन ऑर्गन्स.
Okay.
So this is one word which all of us have heard now, which is called as multi-organ failure.
Correct.
Or affection of multiple organs in the body. Suppose one gets pneumonia. The lungs are affected. Why kidney should get failed?
Yes. That's
Why
the
patient
question.
should become drowsy? किंवा त्यांचं ब्लड प्रेशर ड्रॉप होईल का बरं असं होतं? That is because of this septic process which is underlying.
Okay.
And that is the most dangerous thing, because world over, every year there are more than 11 million people die of sepsis, which is almost 20% cause of all the deaths that are happening.
Oh.
And in India, it is like 3.5 million people every year die of sepsis.
Wow.
So you can imagine the extent of it. आणि फक्त डेथ्स नव्हे, पेशंट जेव्हा ICU मध्ये येतात तेव्हा आपल्याला सगळ्यांना माहिती आहे की इट इज अ व्हेरी इंटेन्स प्रोसिजर ॲज द वर्ड विच यू युज्ड, बट देन इट इज फायनान्शियली इंटेन्स ऑल्सो.
Absolutely.
बिकॉज यू रिक्वायर व्हेरी हाय अँटीबायोटिक्स, यू रिक्वायर व्हेरी क्लोज वॉच, डोळ्यात तेल घालून लक्ष ठेवावं लागतं या पेशंट्सकडे, आणि त्यांना खूप आधुनिकतम उपचार पद्धती द्याव्या लागतात काही काही वेळेला, विच आर लेटेस्ट ऑफ ओरिजिन. आणि त्यामुळे फायनान्शियल बर्डन माणसांवर, पेशंट्सवर, तसंच गव्हर्नमेंटवरती किंवा होल हेल्थकेअर सिस्टीमवरती पण खूप वाढतं. अँड दॅट इज व्हॉट इज द इम्पॉर्टन्स ऑफ नोईंग अबाउट सेप्सिस. आपल्याला सगळ्यांना सेप्सिस म्हणजे काय हे समजलं पाहिजे.
म्हणून हा टॉपिक आपण आज डिस्कस करतोय.
Exactly.
आणि आय एम ग्लॅड की तुम्ही इतक्या सोप्या शब्दांमध्ये आमच्यासारख्या नॉन मेडिकोज ज्यांना हे टर्मिनॉलॉजी ऐकूनच थोडीशी भीती वाटू शकते त्यांच्यासाठी हे सोपं करून
सगळ्यांना माहीत असणंच आवश्यक आहे.
ऍब्सोल्युटली. सो ही सुरुवात होते, इम्युनिटी तुमची कशी रिॲक्ट करते आहे समोर येणाऱ्या गोष्टींना, आणि तुमची बॉडी कशा पद्धतीने, स्पेशली आयसीयू मध्ये असताना, कारण ऑलरेडी थोडीशी इम्युनिटी लो असते.
होय, खरी गोष्ट आहे. सो आजकाल काय झालंय, यू नो द लॉन्जिव्हिटी हॅज इन्क्रीज्ड ऑर देर आर एक्स्ट्रीम्स ऑफ एजेस. न्यूबॉर्न्स किंवा newborn ICU, NICU you have heard,
yes.
or elderly people, or people who have got diabetes. Diabetes has become an epidemic now.
Absolutely.
Or there are organ transplants, or various patients are on various immunosuppressive drugs.
Right.
या सगळ्यामुळे सेप्सिसचा इन्सिडन्स आणखी वाढला आहे. आणि भारतामध्ये आपल्याला माहितीच आहे की ट्रॉपिकल इन्फेक्शन्स पण असतात. फॉर एक्झाम्पल डेंगी. लकीली मलेरिया हॅज कम अंडर कंट्रोल, पण पुष्कळ असतात. रिकेटशल फीवर म्हणा, एंटेरिक फीवर, या कुठल्याही इन्फेक्शन्समुळे पेशंटला ओव्हरवेल्मिंग इन्फेक्शन होऊ शकतं. अँड देन दे कॅन बिकम सेप्टिक अँड कॅन गो इन टू मल्टिपल ऑर्गन इन्व्हॉल्वमेंट.
ओके. पण आयसीयू मध्ये असताना वेन several treatments are going on, how do you detect early sepsis?
Right. So there are two different parts we are discussing over here. कोणाला तरी घरी फीवर येतो, आपल्याला नाही का ताप येत, किंवा घरच्या कोणालाही ताप येतो. आता प्रत्येक तापासाठी काय आपल्याला हॉस्पिटलला जायची गरज नाहीये, पण मग कोणी हॉस्पिटलमध्ये जायला पाहिजे हे कळणं सगळ्यात महत्वाचं आहे.
ओके.
सेप्सिस घरी पण होऊ शकतं, हॉस्पिटलमध्ये होतं असं नाहीये. सो फॉर एक्झाम्पल, घरामध्ये एखादी 40-50ची व्यक्ती आहे ज्यांना ताप आला आहे. कसला ताप आहे कळत नाही, आपण व्हायरल म्हणत राहतो. पण दुसऱ्या दिवशी ती व्यक्ती थोडीशी ड्राउझी होते, ग्लानीत गेल्यासारखी होते, खात नाहीये, युरिन आउटपुट कमी होतोय. सहज हात लावून बघितला तर हात खूप गरम लागतायत किंवा थंड पडलेत. अशा वस्तुस्थितीमध्ये, अशा परिस्थितीमध्ये या रुग्णांना डेफिनेटली आयसीयू हॉस्पिटलमध्ये न्यायला पाहिजे.
ओके.
मग इमर्जन्सी डिपार्टमेंटमध्ये ह्याचं ट्रायजिंग केलं जातं. देर इज समथिंग कॉल्ड ॲज सेप्सिस सिव्हिरिटी स्कोर्स.
ओके.
देर इज वन इंटरनॅशनल बॉडी called as Surviving Sepsis Campaign, because they want to save people with sepsis all over the world. त्यांनी काही क्रायटेरिया दिलेले आहेत, काही प्रोटोकॉल्स दिलेले आहेत, त्याला सेप्सिस प्रोटोकॉल्स म्हणतात.
ओके.
सो त्याच्याप्रमाणे आम्ही असेस करतो. एव्हरी डॉक्टर, एव्हरी नर्स इन आवर हॉस्पिटल at Ruby Hall is trained in that.
Sure.
So it is really very important. Ruby Hall is one of the first hospitals where we have started what is called as sepsis code. किंवा कोड सेप्सिस.
ओके.
ओके. विच इज व्हेरी लेस नंबर ऑफ हॉस्पिटल्स ऑल ओव्हर द वर्ल्ड आर स्टील फॉलोइंग इट. ह्याचा हेतू काय आहे की जेव्हा असा रुग्ण आपल्याकडे येतो इमर्जन्सी डिपार्टमेंटला, तर त्याला आयसीयूत न्यायला हवंय का वॉर्डमध्ये, का थोडीशी ट्रीटमेंट देऊन घरी पाठवायला पाहिजे हे कळलं पाहिजे.
सो ते प्रॉपर डिपार्टमेंट झालं पाहिजे.
करेक्ट. सो त्याचं प्रॉपर ग्रेडिंग व्हायला पाहिजे, सिव्हिरिटी किती आहे ते कळायला पाहिजे, आणि त्याच्याप्रमाणे मग रुग्णाला
लाईन ऑफ ट्रीटमेंट.
आता ह्या सर्व्हायव्हिंग सेप्सिस कॅम्पेनमध्ये काही काही अतिशय उत्तम गाईडलाईन्स दिलेल्या आहेत किंवा प्रोटोकॉल्स दिलेले आहेत असं म्हणू आपण, विच इज विदिन 1 hour ऑफ डायग्नोजिंग ऑर सस्पेक्टिंग सेप्सिस पेशंट शुड रिसीव्ह अप्रोप्रिएट अँटीबायोटिक.
राईट.
विदिन 1 hour. म्हणजे हे किती फास्ट व्हायला पाहिजे, म्हणजे आयडेंटिफिकेशन फास्ट व्हायला पाहिजे, ट्रीटमेंट फास्ट व्हायला पाहिजे, आणि बिफोर गिव्हिंग अँटीबायोटिक वी आर सपोज टू कलेक्ट द सॅम्पल्स. फॉर एक्झाम्पल स्पुटम सॅम्पल, ब्लड सॅम्पल ऑर युरिन सॅम्पल फॉर मायक्रोबायोलॉजी अँड कल्चर्स, बिकॉज दॅट इज गोइंग टू टेल अस विच ऑर्गॅनिझम इज इन्व्हेडिंग. आणि ते रिपोर्ट्स याला वेळ लागतो, पण तोपर्यंत आपण थांबून राहू शकत नाही. वी हॅव टू गिव्ह द फर्स्ट डोज ऑफ अँटीबायोटिक विथ द बेस्ट गेस वर्क.
Right.
आता हे बेस्ट
your experience come into
exactly
play.
So that is where the whole protocolization and the hierarchy of the doctors and the person who is experienced and who is guiding this treatment matters. And that is why in this podcast the right first step matters.
Yes,
it
absolutely.
is very very important.
Absolutely.
आणि समजा पेशंट खूप ग्लानीत आहे किंवा पल्स खूप थ्रेडी आहे, म्हणजे अगदी अशी काय म्हणायचं वीक लागतीये पल्स, किंवा ब्लड प्रेशर नॉर्मली आपलं 120-80 असतं ते 90 किंवा 90च्या खाली आलं आहे, ऑल दॅट इंडिकेट्स दॅट द पेशंट इज गोइंग इन टू डिकॉम्पेन्सेशन.
ओके.
बॉडी इज अनेबल टू
Fight
बॅक. ओके. तर अशा वेळेला श्वासोच्छ्वास हे खूप फास्ट चालतो. आपल्याला माहितीये, लहान मुलांच्यात नोटीस केलं असेल तुम्ही कधी की खूप फास्ट श्वासोच्छ्वास चालतो, फिवर असेल तर, ताप आलेला असेल तर. सो या सगळ्या सिम्पल साईन्स आहेत ज्या घरातली माणसंही बघू शकतात. काय की खूप हाय टेम्परेचर आहे किंवा हातपाय गार पडलेत किंवा कोल्ड स्वेट्स येत आहेत किंवा ग्लानीत आहे पेशंट, डिहायड्रेशन आहे, युरिन आउटपुट कमी झालंय, हे आपण सगळे पिकअप करू शकतो.
शुड इन फॅक्ट माय पॉइंट, इट्स अ व्हेरी इम्पॉर्टंट पॉइंट दॅट केम अक्रॉस तुम्ही बोलत असताना की डॉक्टर्स आणि एक्सपर्ट्स आर गोइंग टू बी देअर फॉर यू वेन यू कम देअर फर्स्ट, बट ॲट होम वी ऑल शुड नो दीज बेसिक्स. फर्स्ट एड घरातल्या घरात प्रत्येकाला जमलं पाहिजे, बेसिकली कळलं पाहिजे. सो देर इज दिस नीड टू एज्युकेट अँड दॅट्स वाय दिस पॉडकास्ट वी आर डुईंग, जिकडे घरातल्या घरात विल नो एक्झॅक्टली what to do the first thing.
Right.
That's why we call it where to go first.
Exactly.
But this is home. But when you come to ICU, because today's whole topic is about sepsis in ICU, detecting it early in ICU कसं होतं?
Right. So we are talking about sepsis happening in the hospital. Let us talk it that way first. Yes. Okay. So somebody who is admitted in the ward for some say abdominal pain or urine infection, and he is being treated in the ward. पण त्या पेशंटला अशाच अगेन सिमिलर साईन्स यायला लागल्या की हाय ग्रेड फीवर आहे, अल्टर्ड सेन्सोरियम आहे, pulse rate is very fast, and respiration is going very high. So these are very simple criteria.
Okay.
So this we take as MUSE, modified early warning signals.
Okay.
Again, all our staff in the hospital is trained for that. And if that is happening, again, sepsis code is activated within the hospital. Okay. And then the patient lands up in ICU because we want to prevent organ failure.
Correct.
So that is the stage. And the third category is patient who is admitted in the ICU for some other reason. Maybe stroke or maybe some other reason. Okay. And within the ICU, he starts developing respiratory distress, rising urea and creatinine, which is indicating kidney function, or starts developing jaundice, or becomes unconscious. So these are the things which are predicting that the patient is likely to go into life-threatening sepsis.
Oh, okay.
So there are categories of sepsis also.
Right. So actually my next question was about these warning signs. So you
I've already mentioned.
MUSE. So MUSE is the term which, so I'm sure the nurses and the staff is...
there is one more score it is called as.
Okay.
SOFA score, SOFA.
Okay.
So it is sequential organ failure assessment.
Okay.
So there are criteria for that which also is followed in the ICU to know the severity of the illness.
The staff and the nurses are trained.
Yes.
As well as the families of the patients who are in the ICU should also be aware and conscious of these signs.
Absolutely.
So the signs that you mentioned.
They have to understand, because once the patient lands up in severe sepsis, it becomes a pure problem of intensive care.
Yes.
So the relatives are involved as far as knowing what is happening with the patient, right? But they cannot really participate in the management.
Unfortunately.
But they have to know what is happening in a patient. कारण पुष्कळदा काय होतं, लोकांना वाटतं अरे आमचा तर पेशंट चालत आला आणि आता काय तुम्ही व्हेंटिलेटरवर घेतला. But they have to understand that these processes are continuous processes and they go on in the body of the patient, physically. And that is why they have to understand that patient can become worse even after bringing to hospital.
Absolutely. And that's why we have to be absolutely aware and alert.
Yeah.
Doctors are doing their job, but as patients' families, we also are responsible in observing the smallest changes, because our body always gives signs. They're always giving warning signs, and we need to be absolutely aware of them. Doctor, what patients are actually at high risk of developing sepsis?
I think I already enumerated some time back that patients who have got their immunity at risk because of some reason. So extremes of ages, diseases like diabetes or diseases like arthritis, which are autoimmune disorders, or patients who have undergone some organ transplants and for which they are under immunosuppression.
Autoimmune
disorders
that are coming to surface
recently
since COVID.
Not only from COVID, autoimmune disorders are there, but now we can
We're talking
diagnose
about-
it in a
yeah.
better fashion, or we can suspect it early.
Okay. So
Or there
that
can be
comes.
comorbidities also, like somebody who is very obese and develops a small infection on the leg, but the body cannot fight it because the circulation is at stake, or some swelling is there, or something like that. So these are called as comorbidities, and multiple disorders are happening or harboring in same patient. That is
Okay.
also a risk factor.
So you just mentioned that the diagnosis has become better. So you mean to say we've got improved technology and diagnostic system
Yeah.
that is now.
Yeah. So diagnosing sepsis requires two things. One is clinical suspicion and clinical assessment, and second is laboratory diagnosis or imaging for that matter.
Right.
Somebody comes with very severe abdominal pain and starts going into sepsis.
Yeah.
We have to find out whether it is a kidney stone, or whether it is a burst appendix, or whether there is something else happening in the body. So very quickly we can do an imaging.
Yeah.
Even on the way from emergency room to ICU, in between scan can happen and patient comes to ICU.
Oh.
So that helps us a lot. Similarly,
in a matter of seconds.
in the matter of seconds. Similarly, the microbiological tests, because ultimately it is which organism is affecting that. Sometimes we are literally investigating and we can't find the
yeah,
organism.
there can be cases like
Because there are thousands of organisms, but we have the test only for maybe 15 or 20.
that. Yes.
And plus there are fungi.
Yes.
You have heard about mucormycosis, which happened in
Yes.
COVID times.
Yes.
So fungus also can affect. So it is like a Sherlock Holmes, for us.
Yeah.
To diagnose infection, manifestation would be overwhelming. That sepsis manifests in a similar fashion. But what causes it? It is really sometimes enigmatic or a dilemma for a doctor to diagnose accurately.
Wow, we can actually imagine.
You can imagine. And that is where the modern technology has come to help us, and we can do various PCR based tests, polymerase chain reaction, or we can do some molecular diagnostics also,
Yeah.
and try and identify the bacteria accurately and whether they are going to respond to the antibiotic which you are giving, because you have heard about antibiotic resistance, and
Yes.
that is another risk factor.
Yes, your bodies are also developing antibodies.
Bodies nahi, bacteria are developing. Bacteria are more clever than us.
Absolutely.
So they are
absolutely.
developing antibodies
Yeah.
to the antibiotics. So the antibiotic which was working few years ago is not
They don't
working
function
now.
anymore because they
But-
have also increased immunity now.
So see, from the point of view of God, either a tubercular bacterium or a human being are the same.
Absolutely, it is actually
So-
quite a bizarre situation that everybody is becoming intelligent at the same time. It's not just the
Exactly.
human beings.
Exactly.
So in such a circumstance, how is the Ruby Hall Clinic's team well equipped, or how they are fighting such a situation?
So in this, managing sepsis,
Yes.
time is very important, crucial.
Sure.
As they say, when you are skating on the thin ice,
Yes.
time is very important.
Absolutely.
The speed is very important. Exactly in the similar fashion, we have to identify, we have to start the treatment very fast. At the same time, we have to get the reports very fast.
Sure.
So as the reports keep coming, we have to keep modifying our treatment, because
Sure.
then we keep on identifying what is happening exactly in that patient. Third thing which is very important is to control the source of infection.
Sure.
Means if there is a purulent or some pus-filled infection somewhere, we have to remove it.
Correct.
If appendix has burst, we have to remove it.
Correct.
So controlling the infection source is also very important. So we have got excellent surgical teams also in any patient if required. So all this is actually calling for multidisciplinary management of a patient.
Okay.
And I really feel proud that at Ruby Hall, we have got all the teams which are working in a great coherence
Yeah.
and together.
There's a brilliant synergy that we can see.
Absolutely.
What is it that patients need to, or the public that we're talking to right now, need to be aware of when it comes to sepsis?
So exactly. So
Or there are any misconceptions or myths that you want to break?
misconceptions are that people feel एक दिवसाचा तो fever होता, असं कसं झालं? काही तर आजार नव्हता. And even though we are saying that some people are more prone to it, sometimes very healthy people also can develop overwhelming infection response. For example, recently we had a 12th standard student, okay, who developed 2 days fever and complete renal failure by the time he reached ICU.
Oh,
And ultimately he was diagnosed to have dengue fever, but all the muscles in the body were affected and swollen up
in the matter of 2 days.
in the matter of 2 days. And this is called as myositis with rhabdomyolysis. And this patient, actually these are jargon words for you, I know.
I just lost the context for a second.
But for example,
what it means?
something unexpected can happen, and then people have to be ready to accept that the diagnosis is such, and we have to manage it accordingly. And there is one very modern therapy which has come in, which is called as blood purification therapy.
Okay.
Because as I explained to you some time ago, that this overwhelming response is actually happening because there are so many chemicals which body is producing to neutralize the invading organism, but sometimes that affects your own. It is like a double-edged sword.
Yes.
And that is why this overwhelming response of these chemicals, these need to be removed.
Okay.
Like in a process of dialysis.
Correct.
So that is called as blood purification therapy. And I want our audience to know that there are some latest therapies like this are also available in addition to antibiotics and organ supportive therapy. And this boy which I was talking to you about, we did administer this therapy for him in 2 sessions. This boy is now a medical student.
Oh wow, that's brilliant to hear.
That is,
Oh, great. So it's not just the antibodies. We need to detox our blood vessels also.
Detox, that is the word. Absolutely.
So
because it's a
detoxification
toxemia.
does not just come in your digestive system.
Yeah.
You need to apply it at various intensive situations also.
Yeah, because these toxins are circulating in your bloodstream and affecting everything.
Correct. And lastly, I want you to simply explain the audience about basic public awareness about sepsis, or in your experience, something that we need to do in our basic everyday routine life to be on toes with our bodies and minds.
That's right. So, irregular lifestyles is something we are all aware of, and especially the younger generation or middle-aged generation which cannot escape it at all. Not only it gives lifestyle related diseases, but it actually reduces your immunity.
Sure.
So, trying to bring your lifestyle to normality as much as possible, that is very, very important.
And more challenging.
That is giving you the normal resistance of the body.
Correct.
Right? Immune response of the body. That is one thing. Secondly, the basic hygiene, of course, that cannot be overemphasized. And I think COVID has taught us everyone about the basic hygiene.
Sure.
So that's
one boon.
That is one boon. And the public hygiene. So all these infections ultimately are also related to public health propositions, various, whatever the programs are carried on. And last but not the least, or rather very important, is taking vaccines at regular times. We are all aware that we give regular vaccines according to WHO protocol to all the children.
Yes.
But similarly, there are adult vaccines.
Okay.
And these adult vaccines help us protect from various infections. Or sometimes even from cancers. You must have heard about that. But I'm talking about infections. So, influenza, for example, swine flu you've heard of.
Absolutely.
That was one of the devastating epidemic which we had.
Yes.
So, you can have a vaccine to prevent swine flu or influenza, which is to be taken every year.
Yes.
You can take a vaccine for prevention of pneumonia.
Yes.
You can take vaccine to prevent meningococcal meningitis.
Yes.
So, there are so many. Tetanus we are all aware of.
Yes.
Similarly, there is a vaccine for prevention of herpes zoster किंवा नागिण म्हणतो ना आपण. So all the vaccines which are there to prevent the infection to go to severe level. We must take that.
Okay.
So with all these measures, we can actually try and prevent infection going to severe level in our own body. And the last thing, when there is fever, don't just neglect it. Be very watchful for the person who is developing fever, because if it is going into decompensated phase, you must approach a good hospital like Ruby Hall early.
Yes, like we always say, you should know where you go first. And in the end, I would just like to repeat one more time. We all just say, it's a very cliche thing to say that prevention is better than cure. But there are so many ways to prevent getting into a situation where it gets out of control for all of us, not just the doctors, but at home also you can prevent these infections that you're actually aware of or may not be aware of. There are so many infections that can come across that we can actually be prepared for and still be unprepared for. But the most important thing that you can do is boost your immunity, stay healthy, stay safe, And let's thank Dr. Prachee Sathe for such an insightful session on sepsis. We
you.
all had
Very
heard of
welcome.
sepsis, we all know about a septic situation, but what you can do in a situation when you're in an ICU, we are in expert hands, but when you're at home, you're only in control of your own hands. So take care of yourself, stay safe. Thank you so much for watching this podcast.